In 3 decades of research and development experience, he is one of the industry's foremost authorities on both digital medicine and the use of VR and technology in healthcare applications. Please join me in welcoming Dr. Greenleaf, who will discuss how virtual and augmented reality will transform healthcare.
Hello, thank you for inviting me to be here with you today. I'm very excited to have the opportunity to give this presentation. I'll be talking about how XR technology, virtual reality, augmented reality, mixed reality technology, how XR technology is going to transform healthcare. First, a little bit more about my background. My center of gravity is with the Stanford University Virtual Human Interaction Lab, but I also spend a lot of time out working with the National Mental Health Innovation Center at the University of Colorado. And I have a number of affiliations with early stage startup companies and a few larger companies. I do this because I'm committed to transforming healthcare by leveraging digital health technology. Many people may not appreciate this, but we're in the middle of a revolution, a digital health revolution. All aspects of clinical care are being impacted. The center of gravity for clinical care is shifting from the clinic and the hospital to wherever the patient is located. We're leveraging mobile health technology, machine learning systems, wearable sensors, and we're leveraging the connectivity afforded by the internet and our mobile technology. Every medical device has been reinvented over the last 10 to 15 years. We've moved from a handwritten analog world of collecting medical data to now ubiquitous digital health system where we're collecting data dynamically from our sensors. We're entering the era of medical wearables where smartwatches and smart band-aids are collecting data and uploading it to the internet so that we can collect more data about our health status. And it's not just the physical aspects of our health status. We're also coming up with new digital systems that collect information about our cognitive and our emotional status. For example, we are able to collect passive data from smartphones to do brain health biomarkers, voice analytics as a biomarker of anxiety and depression, capturing facial expressions as a way of indexing emotional state, and able to use the micro movements we do as we use our smart devices as a way of coming up with a cognitive status score. All this allows us to aggregate the data in the cloud and do some amazing things. On one hand, we can have our smartphones, our VR and AR systems be used as a point of care and provide motivational systems and information for us and experiences for us that can be part of the healthcare process. On the other end, our clinicians and healthcare providers can aggregate the data, come up with better treatment plans, and use the information that's collected on a population basis to come up with better treatment systems. So as part of this digital health revolution, AR and VR technology is having a tremendous impact. We already have a number of systems that have been validated and are out in use clinically right now. And it's really the full stack of healthcare that's being impacted, starting with health and wellness, improved systems for clinical training, improved ways of assessing health status, more robust clinical interventions and health and wellness schemas, and ways to promote adherence, and also ways to reach outlying and underserved populations by leveraging telemedicine. There's more than 200 emerging startup companies that are focused on medical AR and VR technology, and it really runs a full spectrum of clinical care. Addictions, depression, respiratory medicine, stroke and traumatic brain injury, medical education training, emergency medicine, ophthalmology, almost all aspects of clinical care and clinical training have been impacted by XR technology. So let me give you some specific examples. I'll start with clinical training. We have systems that help us train surgeons to do specific surgical procedures or surgical skills, or to learn how to use new medical equipment. We have systems to teach clinical skills such as how to interview a patient. Team training can be done in a multi-user VR environment. And we can use the power of XR technology to allow us to see things from another person's point of view. And in that way, we can facilitate empathy and understanding of the patient experience. One example that I like to point to is how we're using haptic technology combined with multi-user training for surgeons to study up new procedures before they go into the operating room, rehearse a procedure, or perhaps do pre-procedural planning. As a student, it would have been wonderful for me to learn anatomy and physiology using a 3D system instead of relying on a flat textbook. We're seeing a lot of growth in this area, and in particular, some medical schools have abandoned the use of physical cadavers in favor of all electronic training systems. We have virtual patients that can be used for clinical skill training. We can have a clinician learn how to interview a patient, take a patient history, and practice how to respond to difficult situations, rarely encountered situations. We can also do something very important, which is train care providers how to handle critical conversations, how to effectively and compassionately deliver bad news, which all too often we have to do in the healthcare environment. The next zone where XR technology is having impact is on improved assessments, more objective measurements of our healthcare status. We use virtual reality and augmented reality systems to do better medical imaging review, more objective neuropsychological assessments, better ways of measuring functionality for an activity of daily living assessment, new tools for people in occupational therapy or physical therapy to measure status. And then very excitingly, we finally have some new tools to do more effective assessments, more objective assessments in the field of psychology and psychiatry. One thing I'm particularly excited about is we now have new approaches for cognitive assessment. We don't always have to wear something. We can use an augmented reality system or a room environment that we can step into and have a challenge. This allows us to step beyond the traditional question and answer and paper and pencil testing, come up with a more natural, more objective, more functional way of doing a cognitive assessment, and something that can be done in a culturally diverse or age-appropriate manner. The next zone where XR technologies are having a profound impact is in clinical interventions. I'll give you some examples. For example, preoperative planning and image-guided surgery. We can upload an image taken from medical imaging technology. A surgeon and surgical team can decide how to do the procedure in advance, and they can share that information and make decisions in concert with the patient. So the patient understands what's going to be going on and perhaps has some input onto decisions that need to be made about the surgical approach. We've seen some great progress in coming up with new systems to make the difficult and arduous process of recovering from a stroke or traumatic brain injury a little bit more functional and a lot less boring. We see systems that are being developed by large companies like Penumbra moving into the space, and startups like Marion and a variety of other groups coming up with new generation assessment systems, new generation intervention systems for physical and occupational therapy. And one thing that I think is really exciting is the fact that we now have new technologies in the field of psychiatry and psychology. As you may know, that section of healthcare has been backed up with not having enough clinicians to provide and reach the large numbers of our population that are struggling with anxiety, struggling with addiction, struggling with depression, and other mental health issues. And finally, with use of XR technologies, we have some new tools. And I'd like to spend a moment talking about why XR technology is particularly useful in this area. I'll talk a little bit about the neuroscience of how extended reality technologies can have an impact on our behavior and our mental health. VR systems are very effective at activating neuroplastic change in our brains by leveraging our brain's reward systems. We can make an experience much more engaging and much more novel. We can also activate different emotional aspects through the VR systems. This allows us to leverage the brain's reward system. We can also leverage the brain's mirror neuron systems, which allow us to see something from somebody else's point of view, activate emotions within ourselves. And if we can activate a cognitive process, activate an emotional process, we can then teach people the skills they need to manage that cognitive process. This is something that's very difficult to do if you're just using your imagination. But by using extended reality technology, we can leverage the brain's ability to change, to learn. But repetition is required, and we have to engage the brain's reward systems. XR technologies are particularly effective at doing that. The other thing I think is really a strong affordance provided by XR systems is that we can take advantage of our love of narrative stories. We can leverage the power of story to provide superior retention, improved understanding, provide context and relevance, create empathy, promote engagement and participation in the healthcare journey. And we can provide more of a perspective of meaning and relevance to the difficult process of being part of a healthcare system. Healthcare is not fun. And it's often very challenging and requires a lot of hard work. However, the power of extended reality technologies is that we can create a narrative story upon the healthcare journey and engage the patient in their therapy. Some other examples, VR and AR technology are used quite extensively for pain distraction. We've been able to show reduction in the need for narcotics, for example, to deal with acute and with chronic pain. We've also very effectively used VR and AR technology through exposure therapy to address post-traumatic stress disorder, phobias, and other anxiety disorders. This is something that's very difficult to use if we're just using imagination to help someone come to grips with their anxiety disorder. However, by being able to evoke an anxious response in a reproducible, controlled manner in a clinical setting, we can use the power of exposure therapy to teach people how to address their anxiety reaction and teach them the stress management skills necessary. In a similar way, we can use AR and VR technology for addressing addictions. We can teach situational confidence and teach people the refusal skills they need to have in a very ecological manner. In other words, sort of asking them to imagine how they might respond to a trigger for a craving or to peer pressure. We can put them in a controlled manner in a situation that evokes the craving, teach them the skills to manage their reaction to a trigger. There's a long list of how VR and AR technology has been used in psychiatry and psychology. I'll call out just a few. Generalized anxiety disorders, anger management, psychosis, eating disorders, depression, chronic pain, social anxiety disorders, autism spectrum disorder, attention deficit disorder. So many of the difficult problems that we've not had adequate tools to address are being very effectively addressed through the use of extended reality technologies. I'm particularly excited how we now have some new tools to help in senior care with some of the chronic conditions that our seniors are grappling with, such as depression, anxiety, chronic pain, stroke. So many of the ways VR and AR technology are helping healthcare are specifically useful for the senior community. I'm also excited to see that we're finally seeing not just the emergence of particular specific interventions using AR and VR technology, but the emergence of complete platforms that allow not just one particular indication to be addressed, but to also see a variety of different clinical indications addressed by the use of a XR platform. One thing that I think is just around the corner is the use of combination therapy, where we combine a medication with a virtual reality or augmented reality system. This is prescribed to the patient and allows us to have combination therapy. In other words, not just treating with the medication, but using the medication in combination with a cognitive behavioral therapy, for example, to get more effective results. Another aspect of the way XR technologies are being applied to healthcare is to promote health and wellness. We see a number of systems used to address stress management, to teach mood regulation skills, as interfaces for disability solutions, ways to address senior isolation, methods to provide grief counseling, and ways to exercise our brains and improve cognitive function. One of the things that I think is a very powerful tool is the ability to have a dialogue with your future self. In augmented reality or virtual reality, we can create an avatar of our future self. We can age progress, and we can show the consequences of our choices, how our behavior, our sleep behavior, our nutritional behavior, our exercise behavior affects our future health. And having a dialogue with your future self can be a really profound way to appreciate things that often are difficult to grasp just because of the time delay. If someone spends a significant amount of time exercising, but they don't see the results for weeks, it often can be discouraging. But we can use the ability of VR and AR technology to compress and expand time, and the ability to leverage our mirror neurons by having a dialogue with our future self to help facilitate adherence to health and wellness programs. And again, because VR and AR technology lends itself to telemedicine, we can reach outlying areas, underserved populations by leveraging the use of this very powerful technology. I should spend a moment just talking about how COVID-19 is having an impact on the applications of XR technology for health. We, of course, are concerned about how head-mount displays need to be sanitized and kept safe. We have technology to do that, to sterilize them and make them safe to use. What I've been seeing is that because XR technology is promoting telehealth, that there's been a renewed interest. And the introduction of COVID-19 of the healthcare challenge has actually accelerated the process of breaking through the regulatory barriers. Investments are surging into XR for health. Telemedicine in general is getting acceptance. And we're also seeing, because of the stress of all the challenges that we're having right now, both at the care provider level and at the individual level, we're seeing an increased focus on mental health care. And once again, XR technology is a very powerful tool to help in the zone of psychiatry and psychology. So what I'm seeing now is, of the spectrum of different applications of XR technology, we've been seeing considerable activity in addressing pain, managing anxieties, education and training, stroke, surgical planning, surgical skill training. With the introduction of COVID-19, we've seen a shift. And now we're seeing more emphasis being put on issues such as attention deficit disorder, anxiety management, depression, palliative care, phobias, and post-traumatic stress. Okay, in summary, the current XR and VR technologies are founded on more than 30 years of academic research, but finally the technology is escaping from the research laboratory and is being pushed out through the activities of medical device companies and pharmaceutical companies and startup companies, and being brought out into current use. Recent changes in XR technology are making digital health technology affordable. We see XR technology being applied to the full spectrum of academic care for healthcare. And we're starting to see things move beyond just the use by early adopters and starting to be moved out into the mainstream. I think on the horizon, we'll see a further use of this very powerful technology, and it will soon become part of the standard of care. If you're curious about this topic, I suggest you check out the International Virtual Reality Health Association. It's a member association focused on this topic. There's a number of conferences and workshops in this arena, and it's a very exciting and emerging zone of application of technology. Well, thank you very much for inviting me to join you. I'm very happy to have had a chance to do this presentation, and I'll stand by for questions. Thank you very much.
Dr. Greenleaf, thank you so much.
Yeah.
Thank you again. Thank you for coming. We have a couple of questions in the chat room. We're a little long. I'm I'm gonna ask two of them, and you can pick and choose which one you'd like to answer,
Okay.
or in what order. The first is wondering how widespread the use of VR is across the U.S. healthcare system, and the second is around challenges around getting FDA approval and insurance reimbursement. You get to choose.
Oh, okay. Somehow I'm going to find a way to answer both. It actually, VR and AR technologies are in place in many of our teaching hospitals and some of the leading hospital systems in a whole variety of situations. We did some rough arithmetic about 3 months ago, and there were more than, I think there's been more than 100,000 uses of VR in terms of patient encounters, and even more in the health and wellness zone. The regulatory barriers have not held us back. How's that for trying to get to both questions?
That's perfect. Short, succinct, awesome.
Yeah.
We are unfortunately out of time, and I do need to take us to break. Again, I want to thank you for your time. I want to thank you for your years of research on a personal level. I know you've been very helpful to our little startup, OVR Technology. So I personally want to thank you. As we go into break, I just want to remind people that we will be returning at 2:30 Pacific time. So we're going to take a break now. Please remember the VR side events. Remember that all of these sessions are being saved and will be available on demand till we meet again next year at AWE 2021. And finally, a shout out and a thank you to our sponsors, our titanium sponsors, HP, Microsoft, Qualcomm, Unity Technologies, and our gold sponsor, PlugXR. Without their support, we could not pull this off. Thank you very much, and I look forward to seeing you all back at 2:30 Pacific.